Welcome to another My Mind MashUps deep dive where we unravel mysteries, spark curiosity, and make sense of complex ideas together. Today we're diving into something pretty fascinating. It feels almost futuristic, honestly, but it's changing lives right now. We're looking closely at Transcranial Magnetic Stimulation, or TMS. It's about using magnets, believe it or not just medication, to gently, shift the entrenched negative rhythms of a mind that's really struggling.
Right. And our mission today is really to pull back the curtain on this technology for you. We need to break down the mechanics. How does a magnet actually change a mood? And assess the, frankly, remarkable efficacy, especially in treatment-resistant depression, and also explore the profound human side. What does it mean to effectively rewire the brain?
It really is a deep dive into healing. But before we jump right in, don't forget to like, share, and subscribe if you enjoy content that makes you think. Okay, let's get into this, starting with the emotional side. That feeling of being totally stuck mentally. We all know that exhaustion, that heaviness. But when we talk about chronic depression or anxiety, it's often more than just thoughts, isn't it?
Exactly. That stuckness is frequently rooted in the brain's actual physical circuitry. It's physiological.
And that realization is what's pushing people towards things like TMS.
Absolutely. That's driving patient motivation. People are seeking TMS as a genuine alternative because they're just deeply dissatisfied with standard antidepressants, with pharmacotherapy. They often report inadequate relief, they worry about dependency, or they simply can't tolerate the systemic side effects.
Yeah, those side effects can be rough.
They really can. It often feels like swapping one problem for another. So they're looking for something targeted, something non-chemical, to get back to themselves.
It still sounds a bit intimidating, though, brain stimulation.
Right.
But you're saying the actual experience isn't like that.
Not at all, typically. You sit in a comfortable chair, a coil rests gently on your head, you hear this sound. People often compare it to a soft tapping, like a woodpecker, almost.
Woodpecker, okay.
Yeah. And that subtle signal, that's like the Morse code being sent to a part of the brain that might have been, quiet or underactive for years. And for many, that's the moment when they start to feel that fog lifting.
So it's not science fiction, it's physics. How does that actually work?
It's electromagnetic induction. Basically, the coil creates a magnetic field that changes very quickly. Now, magnetic fields pass harmlessly right through bone, through the skull, and as that field fluctuates, it induces a tiny, localized electrical current within the brain tissue right under the coil.
Okay, so the magnet creates the current, and that current is what affects the brain cells.
Precisely. That small current is what gently depolarizes or kind of fires up the targeted neurons.
And crucially, this is all non-invasive, right?
Totally non-invasive. You don't need anesthesia. You're awake, comfortable. It's a very precise procedure.
Which is a massive difference from older treatments like ECT.
Huge difference. And the key thing to understand is that the therapeutic effect isn't just from one zap, it's cumulative.
Yeah.
It's rooted in the brain's own ability to change and adapt what we call neuroplasticity. We're essentially using these pulses to encourage the brain to reorganize itself.
So we're kind of nudging the brain's natural learning mechanisms to fix faulty connections. How does the frequency, the speed of the pulses change what you're trying to do?
That's where the protocols get specific. The frequency dictates the outcome. So high-frequency repetitive TMS, usually 5 hertz or more, that mimics a natural process the brain uses to strengthen connections called long-term potentiation, or LTP.
LTP, heck.
So that increases the synaptic strength, the excitability of that brain area. It gives a gentle boost to an underactive circuit.
Okay, boosting the underactive parts. What about overactive ones, like in anxiety maybe?
Exactly. If a region is pathologically overactive, we use low-frequency stimulation, typically less than 1 hertz. This mimics the opposite process, long-term depression, or LTD, which, despite the name, is about reducing cortical excitability. It helps calm that overactive region down.
So it's about turning the volume up or down in specific spots. But is it just the spot under the coil? Or is it more about the network?
It's fundamentally about the network. That's critical. We aren't just stimulating one location in isolation. The real goal is to alter dysfunctional network connectivity, specifically those frontal limbic circuits.
The frontal limbic circuits, explain those quickly.
Sure. These are the crucial communication loops between the prefrontal cortex, think of it as the brain's CEO, like the dorsolateral prefrontal cortex, the DLPFC, and the deeper, more emotional centers of the brain, like the amygdala. In depression and other disorders, these circuits are often out of balance.
So TMS is trying to get them talking to each other properly again, restore that balance.
Precisely. We use TMS to recalibrate the communication within that network.
Okay, that makes sense. Now, you mentioned protocols. Are there different types of TMS machines or approaches?
Yes, there are variations. The main ones you'll hear about are standard repetitive TMS or RTMS, often using those highly focused figure-8 coils. And then there's deep TMS or DTMS.
Deep TMS, does that go deeper into the brain?
It uses specialized coils, called H coils, designed to stimulate a broader and somewhat deeper volume of tissue, maybe reaching 4 or 5 centimeters down.
Is deeper better?
Well, interestingly, while DTMS is generally more expensive, the big picture from meta-analyses suggests there isn't a significant difference in final remission rates compared to standard RTMS, assuming the standard RTMS is targeted correctly.
Got it. But I hear the real game changer lately has been something called theta burst stimulation. TBS, that sounds fast.
It is. It's been a massive leap forward in terms of practicality and efficiency. TBS uses bursts of high-frequency pulses, but delivered at the brain's natural theta rhythm. And the key protocol, intermittent TBS or ITBS, gets antidepressant effects comparable to the old 30 to 40-minute sessions.
Get this.
In just 3 to 6 minutes per session?
3 minutes. Compared to 40. That's huge for patients.
It's transformative for access and adherence.
Okay, let's talk numbers. For treatment-resistant depression, these are people who've tried meds, maybe multiple meds, and they haven't worked well enough. What are the typical success rates for standard TMS?
For standard RTMS protocols, you typically see around a 50% response rate, meaning significant symptom reduction, and about a 30% remission rate, meaning symptoms are virtually gone.
Which is already life-changing for that 30–50%.
Absolutely. For someone who's felt hopeless for years, that's profound. But then we have the Stanford protocol, accelerated intelligent neuromodulation therapy.
Accelerated is right. What did they do differently?
Instead of daily sessions over, say, 6 weeks, they delivered 50 sessions in just 5 days, highly intensive, using personalized targeting based on fMRI scans.
50 sessions in 5 days. Wow, the results.
Astonishing, frankly. Clinical trials showed response rates hitting approximately 85%.
Yeah, 85%.
And remission rates near 78%.
78% remission. That's almost unbelievable compared to the standard rates.
It really is. And it strongly suggests that perhaps for decades we might have been significantly underdosing with the traditional protocols. It implies that sufficient intensity coupled with that really precise personalized targeting might be the critical factors. It's humbling for the field.
And TMS isn't just for depression anymore, right? It's expanding.
Definitely. The applications are growing. For obsessive-compulsive disorder, OCD, deep TMS is FDA cleared. It's statistically superior to sham treatment. And there's a fascinating twist in the OCD protocols.
Oh, what's that?
They often require symptom provocation right before the TMS session.
Symptom provocation? You mean deliberately triggering the OCD symptoms? That sounds kind of rough.
It might sound counterintuitive, but the idea is to activate the specific brain circuit that underlies the obsession or compulsion immediately before applying the stimulation. It's like getting the faulty pathway online so the TMS can more effectively target it and induce plasticity right where it's needed most. You engage the circuit, then you modulate it.
Huh. Engage, then modulate. Makes sense.
Oh.
What else? PTSD. Addiction.
Yes, growing potential in PTSD. And we now have FDA authorization for using TMS for smoking cessation, which often targets networks involving the prefrontal cortex and the insula.
Okay, this is really promising stuff. If this is resonating with you listening, hit that subscribe button so you don't miss our next deep dive. All right, let's shift to the actual human experience again. We talked about the woodpecker tapping sound. What does it physically feel like on the scalp?
Yeah, that tapping is the most common description for the physical sensation, too. Or maybe a transient tingling right under the coil. It's generally very tolerable. The main side effects people report are usually mild headaches or some scalp discomfort, especially early on, but those typically diminish pretty quickly as the sessions continue.
That sounds way more manageable than systemic drug side effects. But people hear brain stimulation and they immediately worry about memory, often thinking about ECT, electroconvulsive therapy. How clear is the distinction?
It's a crucial distinction, and we need to emphasize TMS's superior safety profile here. Unlike ECT, TMS does not cause memory loss or cognitive deficits. Full stop.
Yeah.
In fact, it's often the opposite. As the underlying depression or anxiety lifts, patients frequently report improved mental clarity, better focus, better concentration. The stimulation is highly localized to mood-related circuits, generally not the memory centers like the hippocampus.
So memory loss isn't the concern. What is the primary serious risk, even if it's rare?
The main serious risk is inducing a seizure. However, and this is important in controlled clinical practice, when all the safety guidelines are strictly followed, The actual incidence is extremely low.
How low are we talking?
The estimates put it at considerably less than 1.1% of patients treated, maybe around one seizure per 10,000 treatment sessions. So very rare, but screening is vital.
And who absolutely cannot have this treatment? Are there definite contraindications?
Yes. Because of the strong magnetic field, the absolute contraindications involve having certain types of metal inside the head or body that are ferromagnetic, meaning they're strongly attracted to magnets and could move or heat up.
Like what specifically?
Things like aneurysm clips in the brain, certain types of deep brain stimulation electrodes, some cochlear implants, or even metallic fragments embedded near the head. Anything non-removable that the magnet could displace. Dental fillings are fine, by the way.
Good to know. So when TMS works well, how do patients describe the change? Is it like feeling drugged or different?
That's what's so compelling. Patients describe the relief in very holistic, restorative terms. They often talk about a strong preference for this non-drug approach. They frame the recovery not as being chemically altered, but as a genuine restoration of their functional self. That fog lifting idea comes up again and again.
So they feel like themselves again.
Exactly. They say things like, I feel like I found myself again. It's the pathological ill self, the depression, the anxiety that's relieved. It allows their authentic self to reemerge. They feel liberated from the illness, not given a new personality by a treatment.
That's powerful. But this ability to, effectively rewire the emotional brain, it does bring up some deeper questions, doesn't it? Some ethical tensions.
It absolutely does. We have to constantly navigate that boundary. Where does therapeutic intervention helping a brain struggling with pathology get back to a healthy baseline end? And where does alteration or enhancement changing fundamental aspects of personality or mood outside the context of illness potentially begin?
Right. That's the worry you sometimes hear. Does TMS change who you are? Make you someone else?
And as we just discussed, patients overwhelmingly say the opposite. It helps them become themselves again. But the ethical responsibility is huge. It demands rigorous informed consent. Patients need to understand the potential for lasting neural changes, even if positive, and ensure the transformation aligns with their own autonomous values and goals for recovery.
And beyond the philosophical, there are very real, practical, ethical issues, like access.
Oh, absolutely. The access gap is a major problem. Despite TMS often being safer, and especially with newer protocols, potentially more effective than another round of meds for some people, the regulatory reality, especially with insurance, often forces patients into what's called a failure-first model.
Failure first, meaning?
Meaning you typically have to try and fail, meaning not get adequate relief from maybe 2, 3, even 4 different antidepressant medications before insurance will even consider covering standard TMS.
Most people who are already suffering immensely have to endure potentially months or years of treatments that aren't working, potentially with significant side effects,
before they can access a non-drug option that might have helped them sooner and more safely. It's a systemic barrier.
And then there's the cost of the cutting-edge stuff, like Saint.
Right. That Stanford protocol, while incredibly promising, comes with a price tag currently around $30,000 to $36,000. And insurance coverage for these accelerated protocols is still very limited.
Which creates a massive socioeconomic divide.
Yeah.
The best treatments might only be available to those who can afford them out of pocket.
It's a profound equity issue that the field needs to grapple with.
Looking ahead, though, the technology itself is advancing incredibly fast. What's on the horizon?
The future is really moving towards remarkable precision. We're seeing AI-guided targeting.
AI, how does that work?
Using individual fMRI brain scans, functional MRI, to map out a person's unique brain connectivity, their specific connectome. Then AI helps determine the absolute optimal spot to place the TMS coil for that individual's brain. Tailored treatment.
Wow. And what about closed-loop TMS?
That's another exciting frontier. It involves using real-time EEG measuring brain waves to provide feedback during the TMS session. The idea is to synchronize the magnetic pulse precisely with the patient's own natural brain activity rhythms, trying to make the stimulation speak the brain's language even more effectively to maximize that neuroplastic effect. It's like having a real-time conversation with the brain circuits.
That's incredible. Any other big areas? Combining therapies?
Yes, multimodal approaches are gaining traction. Research is exploring combining TMS with other therapies that promote neuroplasticity, like potentially low doses of psychedelics such as psilocybin, under controlled conditions, of course.
Leveraging plasticity from multiple angles.
Exactly, and expanding applications into other difficult areas like treating apathy and Alzheimer's disease or tackling chronic pain conditions where brain circuits have become maladaptive.
It's a truly dynamic field.
It really is. And whether you've lived with depression yourself or you love someone who has, or maybe you're just fascinated by the mind, TMS really invites us to imagine a world where rewiring a dysfunction isn't about losing who you are, it's about finding your way back, finding your stable self again.
And remember, here at My Mind Mashups, every single deep dive we do is really about sparking curiosity, challenging some assumptions, and hopefully expanding understanding together. So please do like, comment, and subscribe if you want to hear more My Mind Mashups deep dives. And definitely drop your thoughts in the comments, your perspective, your questions. They could genuinely shape where we go next.
And maybe here's a thought to leave you with. As these technologies for modulating mood get more powerful and maybe more common, we do have to ask ourselves, if technological emotional regulation becomes the norm, does society risk losing its tolerance, maybe even its appreciation, for the natural and sometimes valuable full range of human sadness and struggle?
That's a deep one to ponder. And remember, you can find My Mind Mashups everywhere you listen. Amazon Music, Audible, Facebook, Pocket Casts, Spotify, TikTok, and YouTube. Stay curious and stay kind.